What's up, everyone? Hi, how are you? My name is Linda, a pharmacist, and welcome to this channel. This is World's Best Doctors channel, and in this channel we talk about pharmacy practice and health. So if you feel that is okay with you, please subscribe. Thank you. And today I have a special guest again. Please introduce yourself.
Hi guys, my name is Dr Monalisa, Director of KAC Pharmacy located at Karen. If you need medication, supplements, cosmetics, feel free to holler. She'll put my number down there. So today what are we discussing?
So today we're going to talk about challenges faced by retail pharmacists, right?
Okay.
And you're a retail pharmacist, that's why I brought you here to just shed light on the challenges that you face as a pharmacist.
We have so many challenges facing. Challenges will categorize it to the patient and also to the pharmacist as a pharmacist themselves, as a business person. So we'll start with me as a business person. What are the challenges I face? Number one, let's talk about the cost of living. Currently in Kenya, we have very high cost of living when it comes to products. Now imagine yourself, your salary is still the same, taxes are still going up each and every day. So you can imagine this person won't have the capital to buy the medicine themselves. So affects us because you remember we used to buy drugs at this amount. Now the amounts have already increased. So when the amounts increase, when you increase the medicine, a patient will come and tell you, oh, but I bought it last time at this amount of money. Explaining to them the economy has also affected the price of medicine. It's also hectic. And also you feel bad because at the end of the day, no one will come to a pharmacy just for fun. Someone always comes to a pharmacy for assistance. Another challenge we face is unfair competition. Let's talk about our Pharmacy and Poisons Board. You'll find like most of the major pharmaceutical competitors have wholesale in their pharmacy, and the bad part about it is these pharmacists also sell their medicine products at wholesale price. So imagine you are a pharmacy and your next door neighbor is a wholesaler. Where will clients go to?
They'll go to the wholesaler.
So that's very unfair because we all have regulations, because we start from distributor, we go to wholesaler, then retailer. So imagine someone bypassing the retailer part and selling it as wholesaler. So we receive those are one of the hurdles, which is very major.
And that's why sometimes you go to a pharmacy and then you see so many patients. Like so many patients. You find one pharmacy has a long line of patients. And then if you look at the next pharmacy, it doesn't have so many people. So I think those of us who do wholesale and retail in the same premise, it's not allowed by the law.
It's not allowed by the law. So imagine your neighbor is your wholesaler and you are selling as a retailer, because at the end of the day you want to make profit, you want to pay rent, you want to do so many things with your money. But your neighbor is the wholesaler, and that wholesaler is still selling the same price which he'll sell to you.
So
who will go at a loss? Us as a retailer.
So it's good, as a pharmacist, or if you own a pharmacy, please observe the regulation.
Observe the regulations. It's very unfair. Another challenge we face,
I would say, I think unfair competition from the quacks and other people.
Exactly.
I saw a report by the Pharmaceutical Society of Kenya, which was showing that pharmacists who practice, they own a very little share. I look for that chart and just pressed it here so that you can see 90% of the pharmacies are not owned by pharmacists. They're either owned by quacks or
just an investor.
Technologies, or investors or pharmaceutical technologies. So you see, you're facing unfair competition from the quacks. This quack never trained to school to practice pharmacy, but you've practiced pharmacy, you've trained to practice pharmacy, and then you're getting unfair competition from this people.
And this unfair competition comes in when you employ a quack, you can just give him whatever amount of salary. So as an investor, as a business person, you'll end up getting a quack so that you can cut costs when it comes to employment. And these people don't care about the safety of the patient. Literally, let me tell you, I just relocated. I'm still in Karen. And one thing I've realized, so many patients will come to my pharmacy and be like, I want 2 amoxil, 2 septrin, and then I wonder, like,
why?
Where they say all these pharmacists around me, they can give me 5 amoxil, 3 septrins.
Why can't you give me the same?
Because a normal pharmaceutical technologist, a qualified will never sell 3 amoxil. So you'll end up, someone comes with 30 shillings, give me 2 amoxils. You wonder, where did you get these?
From, it's true.
Yeah, so that's another hurdle we face as pharmacists. Another thing, these people also you employ, let's say you employ a pharmaceutical technologist. Do you know there are some cases where these people can actually sell their drugs?
What? Like
I'm telling you.
Let
me tell you one thing about medicine. If I come with a handbag, I can have medicine worth 100,000.
Wow.
And you won't know, So you'll end up, you're in your pharmacy, nothing is being stolen.
Oh my God.
You check your CCTV, patients are just coming in and out. But when you come to your sales, your stock is okay. But that pharmacist is selling their own drugs. So that's one of the hurdles. You'll end up now, you're paying for someone's salary and also you're paying someone's business. Someone is doing business in your business.
Wow.
Another thing, stealing. They can either, now it comes in 2 ways. They steal from you in 2 ways. Either they sell their stuff, meaning your stuff will never be sold. Another thing, they will steal from you at the end of the month. You do stock take, you find the most expensive drugs that the ones which they're cosmetics, and cosmetics are expensive. So it's so hard. You can literally start your own business with the aim of making money, with the aim of helping your patients, but you also find this person you have employed, they talk to patients badly, because at the end of the day, they're just there for their salary. Let's be honest. When you employ someone is there for the salary. It's very few people will be there to make you grow. So sometimes you'll find out you don't have clients. Why? Because your employee,
the way they talk to the patient is not
that's
good.
Another hurdle we face. So in my 2 years experience, like when you have your own business in pharmacy, let's say 60% of the time, it's all about trust. I can say it's all about trust. Number 2, in a case where someone talks badly and you have evidence someone talks badly, one thing I always advise business people, install cameras which have audio. With audio you can literally, you don't need to be in your pharmacy, but you can listen the day-to-day activities which has been going on, and you can be able to correct. Number 2, treat your people nicely, because sometimes when you give your employee attitude, they will treat your patient with that attitude you left them with. So you need to create a very conducive environment also. And another thing, if worst comes to worst, you gotta fire the person, man. You have to fire the person, because at the end of the day, it's your business. And
and I think that's why it's very, very important for us to even have in our curriculum, like a course. They can incorporate a course on how to talk, like communication skills, so that you know how to communicate to a patient. They know how to talk to different people, so that at the end of the day, if this person comes and then you treat them, they feel good, you talk to them well, they'll always come back, or they'll also refer their friends to you. So I think that can be the case where people are taught how to communicate too.
Communication is key, because how you approach your patients will determine what they buy when it comes to pharmacy. And the knowledge also, you don't just dispense. There is that thing, communication also comes, what's your knowledge? Because a patient wants to know, am I supposed to take it with food, without food, what time? You never take patients like they're smart, they know what they do. When you write 1 times 3, it's not a mouth, the patient needs to know. Because sometimes when you write 1 times 3, patient will be like, 3 times, maybe I can take after 2 hours. As long as it's 3 times a day, I'm good. So as a pharmacist also, this communication, the referrals are the one thing which makes your pharmacy grow. So when you treat a patient well, when you explain to them, never treat a patient like they know everything. Through that, people come back, and that's one of the advantages of good communication skills to your patients.
Another thing that I've seen pharmacists complaining, it's like unfair regulation. So I've seen like pharmacists complaining, like you're just in your community pharmacy, and then there's an official who comes. They say like, hi, I'm a public health official and I want to inspect your premise. And then sometimes they even harass you, sometimes they arrest you. I've had cases where people say like, I've been arrested because I had narcotics and psychotropics in my pharmacy. Yet I am a pharmacist, I'm actually licensed to sell this. But at the end of the day, when you look at these people, like they harass you. So like understanding of the law, I feel like there should be a clear-cut explanation on the law so that nobody walks into your premise and harasses you. Because for us as pharmacists, we are mandated, like we work under Cap 244. Yeah, the pharmacy law that that governs the practice of pharmacy, and under that, I haven't seen that, but I've seen people complaining about like public health officers. So it's That's upon bad. Now, it's upon now us to take an initiative, I think, through the Pharmaceutical Society of Kenya, like explain to pharmacists, like, and also us as pharmacists, we need to like keep abreast of the changing regulations, because that public health officer might have, like, according to their practice, they are allowed to do that, but on our side we do not know that. So I think at the end of the day, we as pharmacists, you as you run your community pharmacy, also keep abreast with the changing regulations so that you're not caught
true. So note to Pharmaceutical Society of Kenya and Pharmacy and Poisons Board, please try to explain to public health it's okay for us to store some medicine, and we are under Cap 244, we are under Pharmacy and Poisons Board, we are not under public health, and that will make things easier.
It's true.
Because the fact that they have the audacity to come into a pharmacy and I've never experienced that, but that's
but
wrong.
I've actually seen it before, even when I was in my previous workplace. Public health officials actually came in and they were checking expiries, they were like checking so many different things. So I think it's up to us to also understand the law and know that yes, maybe they are mandated to do that.
But under what circumstances?
Under what circumstances? So it's good for us.
Because we end up being confused. Are we under public health? Are we under
public health act,
PPB?
Or are we under the Cap 244?
Please trust on your pharmacist. Google, everyone can write an article on Google, and your search engine can direct you to an article, and you may think you're perfect. Come to a pharmacy, you'll be like, oh, I've read somewhere. No, just trust. We are professionals. We have like almost 10 years experience, so we know our medicines. So trust us. Don't trust Google, because Google really messes people up.
True. And that's why I had even some doctors complaining. Like a patient comes to you and they already know what they want you to treat them.
So there's nothing more you can add.
And these days even people use AI. Like they go to ChatGPT, like ChatGPT, I'm experiencing these symptoms. What likelihood disease am I suffering from?
Imagine, because we always say healthcare is the only place where the customer is not
always right. The patient is not always right.
The patient is not always.
You can Google all your symptoms, like you can have headache, fever, diarrhea, all these things. They might have like different diseases can present the same way
with the same, almost the same symptoms. It's only one thing you're looking for. But when you go to AI and you ask, they will all give, you have headache, we'll get paracetamol. You have backache, we'll get some antihistamine, diclofenac. You have
maybe
this.
you can be having maybe a disease,
because at the end of the day, we tend to cure other than treating the symptoms. So most of the time when you go to Google, you'll come.
It will be symptomatic treatment. Because for example, if you have a headache, you might be having high blood pressure and you do not know. But then when you come to us, then you're like, I'm having a headache. Just give me paracetamol. You see, at the end of the day, you might be treating the headache, yes, but the underlying condition, you're not treating it.
So trust your pharmacy, go to a professional, and always ask questions. I always tell my patients, it's your right, it's your money. The moment you cash out in a pharmacy, you have a right to know, how am I supposed to take this? What is the cause? You have a right. Always remember. Another challenge we experience is that some patients already have this knowledge, like, if I feel better, I'm cured. Let me tell you, when you're given a dosage for 10 days, there's a reason why the dosage was given for 10 days. So you need to take it for 10 days. It's not, you'll find patients, you'll come, they'll take the full dose, you treat them, and then an antibiotic, they come back 3 months later. And if you're smart, as a smart pharmacist, you realize, I just treated you like 2 months ago on the same condition. And when you become friendly and you talk to the patient, they'll be like, I didn't finish the dose because I felt good. So patients always remember, feeling good doesn't mean you have cured. Just always finish the dose.
It's true, because it's there for a reason. And one of the global health threats that we're actually fighting right now, it's antimicrobial resistance. And actually when you mentioned that there are these quacks who are selling for people 2 amoxil.
2 amoxil. It's crazy. I'm telling you, this thing is crazy.
It's crazy, and it's going to be a pandemic, to be honest. Like, if you don't curb this, if you don't know your rights as a patient and help us to curb the resistance, we're going to have like
a very big problem.
Very bad pandemic. Yeah.
Another challenges we face also as pharmacists, let me say, as an employee status, you find that sometimes owners make pharmacists or pharmaceutical technologists work for more than long hours. So you find this pharmacist, by the time you come to the pharmacy, they already look so tired. They look so fatigued. So that also will affect the sales and also will affect the outcome of the patients to the disease, because this employer can't work at their best. You can't be at your best. So as an employer, I'll advise, make your employees work for like 8 hours, give them breaks, and also if sometimes you find also these employees, they want to make more money.
It's true.
You as an employer, you need to know a person also needs to be at their best. They need not to be fatigued. So also avoid greedy employees. Also just make people work for 8 hours. 8 hours is enough, so that they can be active and they will be
another thing I've had, like, pharmacists who work in the community pharmacy setting complain about is low pay. So they're really paid like low amounts of money. You remember I did a video on how much a pharmacist earns in Kenya, and if you look at the community pharmacy sector, it was like the lowest earning people were in the community pharmacy sector. So I wonder why this happens.
Because this thing, when you come to the pharmaceutical sector, the big wigs, they already own like 3/4 of the businesses in Kenya, in pharmacy businesses in Kenya. They're owned by a few. And these few people, they're the one who will regulate the salary. Me, I'll advise, when it comes to pharmaceutical sector, we need to have a body which regulates the way medics. You see the way medics, medical officers, they have a regulatory body which controls their pay. We also need to have that. And it's crazy because, let's say, people in pharmaceutical Society of Kenya, people in PPB are the same people, let's say, or they are close associates with people who have the most businesses. So at the end of the day, these are the people who will sit down and say, for this pharmacist, we'll pay them 1,200 per hour, which is very unfair. Per day is not even per hour. At the end, it's very, very unfair. So we need to have an independent body which regulates when it comes to salary. Regulate as a pharmacist, because you can find you're in these big pharmacies, they make even sales worth 200,000 per day, but a pharmacist, they'll end up like per ground watu wanalipwa like 1,200 per day. This is very detrimental. This is very, you don't even have psych. So we need to have an independent body, because when they're put in place with this independent body, pharmacists will now have them good money, because pharmacy is hard.
This is coming up in the, I think, pharmacy practice bill. There's a pharmacy practice bill. So I feel like when we'll be talking about the pharmacy practice bill, these are some of the things that we should actually include, so that at the end of the day, like, as a pharmacist, trust me, you're supposed to be paid a little bit more. Imagine you're working crazy hours and then your payment is really low. And then
it's not like the business is suffering.
And then some people will say, like, at the end of the day, if you refuse, someone else will accept, because there's so many of you who are
unemployed. So we need an independent body.
We need like the pharmacy practice bill, which will look into things like remuneration of pharmacists. I think that will really, really help, because it's very, very bad. I can remember when I was like after internship, you want to you are there for the experience, but the amount of money which they give you, it will end in Uber, like literally. Your Uber, you'll go home and you have like 200 shillings. You wonder, why would I work for all those hours to get this amount of money? So as pharmacists, we work really hard in school. It's one of the hardest courses. Literally, we need to have an independent body, because we suffer a lot compared to medical offices. And I can tell you that aspect, that most of the pharmacists, 3/4 of the pharmacists are owned by few individuals. So they regulate the amount of money to be paid, and they're making a lot of money. So we need an independent body, so that the role of a pharmacist in community pharmacy will be appreciated. And I think it's worldwide. Because I have seen on LinkedIn, I look at it and then I'm like, pharmacists in the US are actually walking out of community pharmacies because of the same working conditions, low pay, harsh working conditions. So most people are now running away from the community pharmacy sector. But then again, in Kenya, I wouldn't want like pharmacists to run away from the community pharmacy sector, because you realize that this is a place that pharmacists can actually make a difference. Because right now, looking at the role of the pharmacists in the community pharmacy sector, it's been populated by quacks, and we as pharmacists need to take up our place. Yeah, so I would just encourage more of us to actually go to the community pharmacy sector, so that we actually make a difference. If you are in the community pharmacy space, if you're working in a community pharmacy, can you kindly tell us, like, you as the pharmacist, you as the owner, what other challenges are you actually facing? And just interact with me in the comment section so that I can know. Lastly, thank you so much for always honoring my call and coming here. I really appreciate it. Thank you so much, and I'll see you on my next video.
Bye.
Bye.